Good afternoon, everybody. Thank you for taking time out of your day to hop on our webinar with us, our next summer transition series for the summer. I see there's a couple people who are still trickling in, so we'll give it a minute for everyone to get settled and then mics and sound figured out, and then we'll go ahead and get started. All right. It looks like our numbers have kind of stabilized a little bit, so we'll go ahead and get started. Just to kick it off with some introductions, my name is Dalton. I use he, him pronouns, and I'm an assistant director with New Student and Family Programs. So we're excited to have you all here with our next summer transition series event. Before we get started, well, let me share my screen, and then we'll go over a few housekeeping pieces of information for those in attendance, and then we'll hand it over to our campus partners. So first and foremost, our topic for today is Staying Well at Duke, Part 1. There'll be an additional segment to this topic coming up here soon. But as far as the webinar today goes, at the bottom of your screen, you should see a way to ask questions with the Q&A format. Those questions come to the panelists and the hosts, and we can review those and answer those. If they are pertinent to the entire audience, we'll ask them out loud and share answers out loud. If they are one-off questions, we can respond directly to you in the chat that way. Most of our answers will be answered live, so that way everyone has a chance to get the information that they need. I would imagine most of the questions are ones that everybody has, so it's helpful just to put that information out for everyone to hear. You will notice that chat has been disabled, so there isn't a way to communicate directly with other attendees or with the webinar hosts themselves. So the Q&A function is going to be your best feature to reach out to us. And then the last piece of housekeeping is our webinar is being recorded. Obviously, students and families are coming from all over the world, many different time zones, and in the middle of the day is not always the most conducive time for students to hop on and participate. So it is being recorded, and it will be available on our YouTube page within a couple of days. So students can review on their own time as needed. That I think is our big webinar housekeeping parts. We'll do some introductions now. We have a couple of campus partners joining us from nutrition, immunization, and insurance. So I think, Franca, I'll turn it over to you to introduce yourself.
Sure, absolutely. Hi, everybody. My name is Franca Alphen. I use she, her pronouns. I am the Director of Nutrition Services at Student Health, and all of us presenting today are a part of Student Health. So nutrition services are a part of that. I work with Tony Ann Apadula. Both of us are registered dietitians. And I want to talk just briefly about what some of the nutrition services available to you are. Dalton, if you wouldn't mind going to the next slide. So we have this QR code. There you go. If you want to just take your phones, and the QR code will bring you to, you're going to see the web page in a minute, but it's basically, it will be nutrition resources and information. And this website has all the information that most of you would want to know. Let me just say that nutrition services are available to all of you as part of your health fee. This does not go through your insurance. So if you're enrolled in classes at Duke, you're paying a health fee, and that means nutrition services are covered. You can see us as often as you like. Typically, we see students, some just once or twice, some we see every other week. We see students for a variety of reasons, whether it's just being healthy, switching vegan or vegetarian, needing support from having some eating issues. So we are here to support you in any way that we can. Dalton, if you don't mind sharing the screen with just showing them what some of the things are, perfect. So on the left side there, you'll see there's a Cook's Corner. You can either click on the picture or on the word, and that will bring you to our website that has all 2-minute videos on how to make a variety of dishes, starting anything you can make many of these in your room. This is not just somebody who has a kitchen. Most of you know that you do have a central kitchen in your dorms, but we thought these are fun videos if you wanted ideas to try something new. Again, they're about 2 minutes, shows you how to make them. So I just want to put that resource out there for those of you that are interested. And now if you don't mind going back to the other page, Dalton, that would be great. And then scrolling down here, you can just literally click there to make an appointment with us, and that comes directly to Tony or myself. So we're happy to schedule an appointment. And then if you scroll down a little bit further, you will have, keep going. Yeah, you will have a whole variety. All of these are separate handouts. So if you're worried about eating well at Duke, we have handouts on that. If you're worried about protein, if you're worried about fitness, we're here to support you and helping you with all of that. But I did want you to know those resources are available to you on the website at any time. But again, feel free to take advantage of the appointments. Just go ahead and click on that and make an appointment with us. Because this is part of the health fee, you actually won't be eligible to meet with us until classes start. So once you arrive, all of you are in pre-orientation programs, that technically counts. So we are happy to see you once you get to campus. But before then, because you're not enrolled in any classes, this service would not be available. So thanks so much for your time. And I'm going to, I think, pitch it over to Lynn, and she will take it from here.
Hello, everyone. My name is Lynn Kenyon. I am one of the nurses at Student Health. Specifically, I spend most of my time in the immunization department. And we're going to go over a couple of things regarding student health, our services, immunization, and things that students need for compliance for the school year. First of all, student health hours. We're open Monday through Friday, 8 to 4:30 with our last appointment at 4 o'clock. We are not open on Saturday or Sunday. However, we do have a triage nurse for after-hour phone calls. And you can see on the screen that number, 919-681-9355. And obviously, if there's an emergency, you should call 911. The services that are offered, next slide, the services that are offered at Student Health, we have women's health, including gynecological exams. We have men's health. As you just heard from Franca, we have nutrition counseling. We have an immunization, an allergy, and a travel clinic. We have the nurse advice line. You can get x-rays. We have radiology. We have laboratory. And our staff includes medical doctors, PAs, nurse practitioners, RNs, LPNs, CMAs, and registered dietitians. You must make an appointment to be seen at Student Health. Next slide, please. You must make an appointment, and you can make an appointment by calling the number 919-681-9355, wait for the prompts, and then you can push options 1 or 2. You can also go via your, it has changed. It used to be called MyChart, but now it's called My Duke Health Now. So you can make an appointment that way, but if you're unable to, if you have some, if there's limited availability or you just need assistance, just call the 919-681-9355 number, and you'll be able to get an appointment. Next slide. As far as specialists, if you need to see a specialist at Student Health, like a dermatologist or an orthopedics, you have to come to Student Health first to be seen, and then you will get a referral. The referral staff will help you facilitate an appointment with a specialist. The after-hours nurse advice, we talked about that earlier. Again, it's the 919-681-9355. Also, again, you know, if you're calling after hours and it's an emergency, the best thing to do is call 911. So immunization compliance, that is obviously a big thing going on right now for Student Health. Per North Carolina law, all of our incoming students must complete the mandatory immunization requirements by the 30th day of class. And all of this information is on our Student Affairs website that you see on this slide. In the process, you're going to upload all of your immunization records to your Student Health Gateway. And then you're going to refer to the secure message that you receive by our records processing team via your Student Health Gateway. If you have questions after you've uploaded your immunization forms, you can send those questions to immunizations@duke.edu. And there is a list of frequently asked questions that can be found on the website. So maybe look at those first before you send an email to the immunizations website, because it might take a day or two to get answered. So the mandatory steps for immunization compliance, again, this is on our website, but step 1, you're going to complete the online TB screening questionnaire. After you do that, you will receive an email. You're going to print the PDF and then follow the instructions provided. After that, you're going to take your immunization form that is provided by Student Health, and you can access that from the website again. Take that to your medical provider, and we do have a form for undergraduates, graduate students, and health science students, because each one of those categories needs different things for compliance. You're going to take that form to your medical provider, and they're going to sign off on it. Then you're going to log into the Student Health Gateway, and under the Medical Clearances tab, you're going to submit your information. I'm trying to think if I said everything. You're going to submit your immunization form and your TB screening questionnaire. Okay. And if you're struggling and just having problems and cannot submit your information, you can always send it to the immunizations email, or you can fax it to the 919-681-7386. And that's only if you're just at your wit's end. So, and please, like step 5 says, please monitor your Duke email, because that's how we communicate with you to let you know what you might need for your immunization compliance. And then the last part of the mandatory compliance is register for your MyChart account. Well, it's now a different name. What was it again? The Duke. I don't know.
The My Duke Health Now.
Yeah, My Duke Health Now. You're going to register for that after July 1st. Okay, so next slide. This slide shows you what the immunization form looks like. And again, there's a form for undergraduates, graduates, and health science students. And so again, you just have your medical provider put the dates of vaccine, the date the vaccine was given. They have to sign it, they have to date it, and they have to stamp it. And then of course, make sure your name, your date of birth, and if you know your unique ID, that's helpful as well. Make sure all of that is filled out when you submit that immunization form. Okay, next slide, TB testing. Duke only accepts TB testing that is done in the United States. So our international students will have an opportunity to receive any necessary vaccines and TB testing when they arrive at Duke. And those, we're going to have a walk-in clinic at Penn Pavilion. And that's when you're going to have an opportunity to get the TB testing and the vaccines needed. And those specific dates are August 17th, August 18th, and August 19th. And then August 21st through August 25th. And we'll be open 9 a.m. to 3 p.m. And again, it's a walk-in clinic, so no appointment is necessary.
Hey, Lynn, real quick, sorry to interrupt you. It's the 19th to the 23rd, Monday through Friday.
Oh, okay. I messed up on those dates. Okay.
You're good. You just had the 25th instead of 23rd.
Oh, the 25th. Okay, gotcha. Okay. Okay. We also, if you're waiting, okay, so if there are immunizations that you need and you're waiting the specified time frame between vaccines or titers that you might need if you're a health science student, your status on Duke Hub and the Student Gateway remains not satisfied. However, on our end, you'll be listed as partial. So Student Health will send you a reminder message through your Student Health Gateway when your next vaccine or titer is due. So we don't want anybody, being stressed out. We will communicate with you. But it is important that you monitor your Duke email, because communications regarding your compliance status can be found by logging into the Student Health Gateway and clicking on Messages on the left toolbar. Your Duke email will notify you when a new message has been sent. And it's also important to keep up with your immunization status so that you're not removed from your class or your clinicals. Because again, you have that 30-day time frame from the first day of class to get your compliance done. That's all I have. And so now I'm going to toss it over to Calvin.
Okay, I see that Deja's on the call. I don't know if she wants to speak or not. I don't have any fancy updated slides to show you guys, but I can talk about the insurance policy. Your student insurance policy or Duke SMIP, student medical insurance policy, is a Blue Cross Blue Shield insurance policy from the state of North Carolina, but has complete access to the Blue Cross Blue Shield network in all 50 states. So you're not limited to the state of North Carolina. You have coverages for emergency services only outside of the United States. Just remember, if you're vacationing or going back to your home country, if you're an international student on a visa, then you would have insurance coverages, but it's for emergency services. So no routine or non-emergency services would be covered outside of the United States. While you're at Duke, you're going to see a charge on your account called the health fee. The health fee allows you access to Duke Student Health, which is listed here. Duke Student Health, CAPS, Duke Well, and Duke Reach. That is, in essence, a semester-long copay. So while you're at Student Health, there's no copays that apply. So you can come in and ask to speak to a doctor pretty much every day if you need to, or at least every day that we're open without any charges to your insurance policy. The only time we would bill insurance is for labs, immunizations, vaccines, travel vaccines, and x-rays. All other services inside of student health do not get billed to your insurance. So in essence, there's no insurance charges that will generate on your account. For your insurance policy, of course, it is for the student only. We only service the need of the student. You can request to have a spouse or dependent enrolled into your insurance policy. Of course, it comes with a significant charge, but they would have the same identical benefits that you do. The insurance policy will start on August the 1st and end July 31st every year that you are listed as a Duke student and that you're enrolled into the insurance policy. August 1st through July 31st begins the school benefit year, which is different from a traditional benefit year. Traditional benefit years are normally from January 1st to December 31st, but since you're in school, it's August 1st through July 31st. On the screen here, as you can see for insurance and billing, if you have any questions regarding your insurance, you can always send an email to the insurance mailbox at insurance@studentaffairs.duke.edu, which is listed on the third dot. Or you can actually call the main insurance line at 919-684-1000. That telephone number will ring in 3 different offices. So more than likely you'll get either myself, Jeanette Clayton, who is the other insurance care specialist, or DJ Wells, who is our in-house Gallagher student coordinator. So either one of us will be able to answer the phone. The only thing we ask is if you have to leave a message, please give us time to get back to you. Just keep in mind that we are coming into the fall enrollment period, and there's roughly about 18,000 students that's going to be trying to submit insurance information and get insurance related questions. So it's going to take us a little bit of time to get back to you. Questions about dental insurance, that's going to be more on Deja's behalf. I don't handle dental enrollment. You can still enroll into the dental insurance policy through the Gallagher link that'll be provided to all students once the link is sent out to all students through your Duke email account. So please continue to monitor your Duke email account for changes, updates, and critical information regarding immunizations, insurance, or anything university related. If you need to, that dental information that's at the last bullet point, that dental box is closed. We don't use that dental box anymore, so please do not send any dental emails or try to contact that telephone number. You are going to use the bullet point number 3, which is the insurance@studentaffairs.duke.edu. And then that telephone number 919-684-1000. Deja, like I said, I see that you're on. Is there anything that you want to add?
Yeah.
Students?
Yes, I also want to inform students that Gallagher will be sending out communication, so be on the lookout for that regarding waiving an enrollment period. We do go live on next Monday, so communications will be sent out Monday, June 17th. It will be able to give you a walkthrough of everything that you need to do. Again, the link will go live next Monday. You will have, if you have any questions, again, feel free to reach out to Calvin and I via using the email that's listed on the third bullet point or phone number as well. And also regarding dental, you can use that email, the insurance at Student Affairs. Calvin just forwards it to me, and so I'll be able to provide any information that might be needed for any of you students regarding dental. Oh, and I also want to remind students, you can always add an alternative email to add your parents' email or family email address that you might have. So for your parents, so they're aware also, and they're able to get communications from Gallagher as well. And I believe that's it for me.
One thing I will reiterate, and I think Lynette Canyon talked about that. Please continue to monitor your email account for changes and updates. We get notifications if there's an email sent to you that you do not open. So please continue to monitor, because a lot of the information that you may receive either from immunizations or insurance is time sensitive. So we don't want you to miss any deadlines or put yourself in a situation to where you have to be pulled out of classes because you missed deadlines. So please, please, please continue to monitor your email accounts, your university email accounts, for any changes, updates, or times that you would need to complete information. So that way you don't, like I said, get pulled out of class, or, worst case scenario, be dismissed from the university. So we don't want you to go through that situation. If there's a situation that arises that you may need an extension, you may want to contact us right away and let us know that there are some situations beyond your control that you are not able to meet the deadline, where we may be able to offer additional assistance to extend the deadlines for you. But you have to remember to read your email. And the worst case thing you can do is say that you never got the email. Like I said, your emails are date and time stamped down to the second. We know when you've opened the email and when you haven't opened the email. So please continue to monitor your information. Anything insurance related, please, like I said, give us a call at 919-684-1000 or send us an email to insurance@studentaffairs.duke.edu. The insurance email is the fastest to get in contact with us. I can't speak on Deja's behalf. I know for my phone, my telephone is set up to go for the voicemails to go from newest to oldest. So if you call to ask an insurance related question and 50 people call after you, then that means you're call 51, not call number one, where my email is set up to go from oldest to newest. So if you send your email and 50 people come after you, you're email number one. So I always tell students to make sure you send an email because that's the fastest way. But if you need to send a voicemail message or if you need to call, please do. We will get back to you either way as fast as we can. And I believe that's all that I have.
All right, great. So I think the final slide that we have is just a welcome to Duke. Looks forward to assisting you all. And then we have the Q&A for the rest of our time here together. So I know there have been some questions that have come through in the chat. Now is your time. If you have other questions, please feel free to type them in. I'm going to go ahead and stop sharing my screen. And then I think we'll just start at the top and work our way down with whoever feels the most capable of answering. So the first question we have is just around some immunization shots, saying that they are still not satisfied or awaiting review. What should we do with that?
Want me to answer? Okay. Am I reading the right one? Okay, so the Hep B series, is that the one we're looking at? Not satisfied, but according. So right now we're still processing records. So There could be a couple of reasons why her hepatitis B series are not satisfied, but we won't know until we can actually process the record. So in a general answer, give us 3 to 4 weeks to get all the records processed. And like we said earlier in the presentation, you will be notified via your Duke email of anything that you might need regarding your immunization compliance. And so you will be communicated to regarding anything that that you're missing or you may be needing.
Great. I think, Lynn, this question might come right back to you again with the next one. If a child gets allergy shots weekly back at home, who should we talk to about getting allergy shots transferred to Duke?
Actually, I'm going to turn that one over to Crystal.
Okay, great.
I can answer that. So we do have an allergy nurse here at Student Health, and we do not have an allergist. So we do accept your orders and your serum and all of your flow sheets from your home allergist. We do have an email address. Also this information is on the Student Health website. So it's best to go ahead and start communicating with the allergy nurse and sending over your orders and your flow sheets. And the email address is dshallergyclinic@duke.edu. But we have the forms that need filled out by your home allergist on our Student Health website in the allergy section. So please feel free to read that section and then print those forms, take them to your home allergist, and get them sent in.
The
Great.
next question regarding the TB test, I can answer that one. And the answer is yes. TB testing is mandatory for enrollment compliance. And the deadline for the fall is June 15th for the fall semester.
I'm gonna jump down a little bit. We had a more recent question around if we got vaccinated and TB tested in Puerto Rico, is that considered an international or a domestic? Since I know the Puerto Rico is a U.S. territory.
I would say domestic since it's
Yes, right. Agreed. Domestic. Yes.
Great. Thank you. I figured I would keep on theme and jump down since that's how that one came through. Health fee being different from insurance fee, is that correct?
correct.
Yes. And there's definitely a significant price difference as well. So with health insurance, you're looking at about $3,464 versus I don't know how much the health fee is, but you'll be able to differentiate the difference based on price as well.
The fall health fee is $484. Just keep in mind that the health fee is for CAPS, Counseling and Psychological Services, Student Health, Duke Well, and Duke Reach, for services that can be used in those particular areas without any charges to the insurance policy. Without those, without the health fee added to the student's account, the student wouldn't be eligible to use Student Health, CAPS, Duke Well, Duke Reach for services. Now, with the health fee, there are services that are included, like Franca and Tony are nutritionists that are on staff. That's part of your health fee. Your doctor's appointment at Student Health, certain tests that can be done here are part of your health fee as well. Outside of Student Health, if you were to go to a doctor, then co-pays would apply, and any services that the provider would do would all be billed to your insurance. So that's why we tell students Duke Student Health will be your primary care physicians while you're on campus, because we don't charge any co-pays. That's all part of that health fee. Any doctor's visits or anything like that. Where if you go outside of Duke Health, you're going to pay pretty much for every little thing that they do.
Thank you, Calvin. The next question we have here is, if my insurance will end in the middle of the school year, could you register for Duke Health Insurance then? And if I only have Duke Health Insurance, will you be uninsured during the summer?
So to answer the first part of that question, if your insurance ends in the middle of the school year, Could you register for Duke Health Insurance? Yes. Eligible students can always enroll if they're going to lose coverage for whatever reason, or what we call qualifying life events, or QLEs. Could be childbirth, a death in the family, you lose healthcare coverage for whatever reason. Students can always enroll. Now, the only time they would be able to make changes as far as waiving out of the insurance policy are only during the enrollment periods. So the enrollment periods is the only time that the students can make changes with the insurance, except for, like I said, if they have a qualifying life event, meaning if it's a female student that has a child, or if it's a same-sex couple that wants to adopt a child and where they become parents or legal guardians. And it's the same for, any other person that wants to be a parent, if they become a parent or legal guardian or adoption, or however you want to phrase it, then of course they can have the child or family member added to the insurance policy, but it has to be done within 30 days of either the childbirth, the adoption, or when you become a parent or legal guardian. What was this? I'm trying to
The
remember.
next question, I believe, was about summer.
Oh,
So the
okay.
insurance, there is no lapse in coverage if you're a continuing student. So with the enrollment, with your effective date starting August 1st and your term date being July 31st, there is no lapse unless you're graduating, this upcoming upcoming spring 25, then that will be different. But there is no lapse. You'll be covered throughout this summer. So if you're taking any travel abroad, you're covered for emergency if you do decide to travel abroad.
Great, thank you. For dental and vision needs, does Duke Health have a list of local recommended providers that they share?
So our dental is through Aetna. So once you enroll, you can go on that website and type in the zip code and look to see any providers that are outside. Duke also has a campus smile, so that is on campus. So if you want to utilize on campus and not have to drive anywhere, you're more than welcome to use the on-site dental office that is actually on the first floor in the Wellness Center. And Vision is also, I believe, on Irwin Road, so it's almost a walkable distance if you need to receive any glasses or get your prescription filled for your contacts.
Great, super helpful, thank you. And then I think for this one, just to clarify, is the Duke SMIP a separate cost, or is it part of tuition? I think we talked about it a little bit, but maybe we can just clarify, Calvin.
It's billed all together. So whenever students receive their fall billing statement, when you receive your billing statement, it's a snapshot of everything you're going to be billed for the fall, which includes insurance, health fee, and any other fees, room and board, meal plan, tuition, parking. So all that is going to be a snapshot of everything that you're going to be billed for the fall. So that will be added on your billing statement before any changes are made. So that way it gives students an opportunity to budget accordingly if they need to. So that way they don't send the initial billing statement out and then start adding charges after you've already made your budget on how much you're paying, or your scholarship, or if you need to get financial aid assistance or anything like that. So that's why they built everything up front. So that way you get that snapshot to see how much you would owe if there was nothing taken out of the billing statement.
Dalton, if I can just interject 1 minute, there was a question that I was going to type the answer to. Somebody was asking if their doctor prescribed medication for their student in a different state, how could they continue to have it filled here? That student would just have to meet with any of the medical providers at Student Health, and usually that's not a problem at all. They can continue to write the prescription for whatever that student would need.
Great, thank you, Veronica. Does Duke Health offer meditation, fitness, and the like, either webinars or classes, or do those typically offer through the fitness center or other Duke vendors?
I'll take that one too. I work quite a bit with the Wellness Center as well, and Duke Well. So Do Well is our wellness arm, and they offer lots of things: yoga, Pilates. It's also offered through Duke Rec, which is the Wilson Recreation Center. It's also offered on Brody, which is the fitness center on East Campus for all the freshmen. So we have a lot of those courses offered through Duke Rec, but then wellness does a lot of the meditation, card playing, tea, drumming. So we have a variety of different options that are offered through wellness. That's all part of your health fee, I believe. There is not an additional charge for any of those, and the same would be for the classes that are offered through Duke Rec.
Great, thank you so much. I think the next question here is kind of back to the TB process. So if my immunizations are complete, but TB screening results are still pending and may not get here by the 15th, should we still submit the immunization form first and wait for TB results?
Yes, submit anything and everything you can now, because again, we have an incredible amount of records we're trying to process. So anything you can submit to us right now is helpful. And if you're an international student, you can, like we said before, you can't get your TB testing until you arrive at Duke anyway. So then we have those clinic dates as well. You can get them done during those times, and it'll be fine.
Thank you. Do we have to submit immunization shot records to the Duke form itself, or can we submit them through separate forms that are list date and times and is stamped by the doctor?
We do take forms that are considered licensed, from any licensed agency, but they have to have the student's name, date of birth, the date of the vaccine given, and then it has to be signed by, like she said, a medical doctor or some type of medical provider. And that also has to have an address that we can verify that it's a licensed agency.
Great. Thank you for clarifying, Lynn. Appreciate that. When do we need to submit the consent to treatment and minor consent form in the Student Health Center?
It's not considered compliance, the consent to treat, but they do need to sign that so that they can be seen at a Duke facility. Cal, you and I had a talk about this earlier today, but the consent to treat means that they're giving us their consent to be treated at Duke, at the Duke facility, and in some cases bill their insurance as well. But they need to have it filled out with pretty much with all their other stuff. So
And is there a deadline?
it's not going to keep them from being compliant though, but it's necessary.
Okay. Is there a deadline for that as far as when it needs to be signed and submitted?
Not to my knowledge for the consent to treat. But again, if they're coming to student health to be treated, they're going to have to sign the consent to treat. And especially if they're a minor, they have to sign that consent so they can be treated.
It's not just student health, that's any Duke contracted facility or provider may request the person to complete a consent to treat, just basically saying, yes, you're giving us permission to treat you for whatever medical or vision issues you may be having.
Perfect. Thank you. Backtracking a little bit, the name of the vision office, Deja, do you know the name of it? I'm assuming the off-campus one.
I can put that information in the chat.
Great. That'll work. Okay. And then I think the final question we have is, which I think the answer is yes, but do all students have to get TB tested?
Well, the answer is actually no, but
Right.
all students have to send in a TB screening questionnaire, and that lets us know if they need to be TB tested. So it is part of their compliance, that TB screening questionnaire. And then again, if they need to be TB tested, then they'll have to get that done.
Perfect. Thank you for clarifying on that one.
Mm-hmm.
And I think that is caught up on all of our Q&As that have been submitted so far. So, so I think that's about it. Unless there's any final questions anybody has, feel free to submit them now. Otherwise, I think we'll go ahead and wrap up. Our next summer transition series, I'll go ahead and share my screen back up here again. But our next summer transition series will be a week from now. We'll have Duke 101, which is some big general needs of information around Duke. And then part 2 of this, Staying Well at Duke, will be following in 2 weeks on the 25th. All of those are available to be registered. You can register for those webinars on our website. They'll also be going out in our weekly Duke Digest emails. So we have those there as well. Staying Well at Duke Part 2 is going to touch on some of those resources that we talked about earlier that are not student health focused, or not student health offerings, but are still focused on wellness at Duke. So a good chance to come learn about some of those other resources here on campus. If you do have other questions that come up, or if you are viewing this live or viewing us at a later time and have some questions, please reach out to the Student Health Center based on some of those emails that we shared early in the presentation. You can also always email studentorientation@duke.edu, and we will field those out to the people who are able to answer those questions and get you in contact with who needs to know. So I think with that, we are good to go. But I just want to say again, thank you. Huge shout out to our campus partners who've been here helping share this information. Hopefully you all found some benefit and some value in this webinar, and we look forward to seeing you again at future events. With that, I'm going to go ahead and end the Zoom room. Thank you all so much, and we'll see you at some future events.